KLAS Research is an organization that was established about 16 years ago in the United States in an effort to make healthcare better. We conduct about 25,000 interviews per year with different healthcare organizations in understanding what's working for them in healthcare IT, what's not working, and what some of their future plans might be around healthcare IT. As I said, 16 years in the industry, and we've developed a great relationship with a number of healthcare organizations there in the United States. But about 2 years ago, we started to see an increase in interest in our reports from the UK. We started to see web hits for our various pieces of research. And so we said, well, something's happening in the UK right now, and as it turns out, that was about the time that MPFIT announced that it was dismantling, and that the trust would now have an opportunity to select their own EPR solution, and it wouldn't be dictated to them anymore. So we thought, well, maybe there's an opportunity for KLAS to gather research in the UK and help providers make some of these decisions. These are not small decisions that they're making, and if our history is any indicator in the US, then perhaps KLAS can share some of that data back to the provider. So we conduct those interviews here in the UK as well, and in exchange for their time, we provide most of that data back to the healthcare organizations for free. It's kind of a nice symbiotic relationship that we've developed. And as you can imagine, many of the suppliers and vendors are keen to know what their customers are saying about their products. So we're also able to develop a relationship with the vendors and the suppliers as well. And as far as weaknesses and challenges for KLAS in the UK, being a US-based organization, there's been a learning curve around what's different with healthcare in the UK versus the United States. And frankly, many of the suppliers are finding the same challenges. How do we anglicize our product? Or how do we view the way medicine is practiced in the UK differently from the US? So that's probably been the biggest challenge for us, is how do we engage with providers and make our data meaningful for them, given the system that they work in. Policy is probably one of the reasons that it's a little more difficult, and really it's just a matter of us understanding the policy and how we can still have that impact. I'll give you an example. We did a GP report earlier in the year, and to give you a comparison, that report included full ratings on the three GP suppliers, and then just a little bit of data on the very small supplier microtest. To give you a comparison, there are over 700 suppliers in the US within that same segment. So that's been a big adjustment, is understanding, given the population, given the opportunities for the different suppliers here, and how a healthcare organization can take advantage of what's good about those suppliers. It's difficult, but it's fun.